is activated by the monoxygenase. Mechanism of action is same. It will inhibit the mycolic acid inhibition, which will decrease the cell wall inhibition and kill the bacteria. Beta the bactericidal and bactericidal effect, and the effect is depend upon the concentration. If we give the less amount of the drug ethanamide, it will just cause the bacteriostatic effect. If we give the if we increase the concentration, it will kill the bacteria. This is a pyridine with ethane. See, this is ether. Thio means S. Thio means S. And amide is amide. Then we have a ethambutol. This is a ethambutol. Make sure don't be confused between ethanoamide and ethambutol. Amide and ethambutol. Ethambutol is a first line drugs. It is a bacteriostatic, means it will just stop the growth. Stop. It is the like mirror image of this. This is butol. 1 2 3 4. 1 2 3 4. Ethambutol with alcohol, and it 1 2 ethambutol, and M is for, I guess, amide. What will do? Ethambutol mechanism of action: interfere biosynthesis of albino-glycaton. Albino-glycaton is a structure on a cell wall which is supported by which supports the peptidoglycan. Albino-glycaton supports the peptidoglycan innermost layer of the Mycobacterium tuberculosis, and which is supported by, like, in the between the albino and peptidoglycan there is a mycolic acid which connects the both part. So if we interfere the albino-glycaton, there will be no production of cellular polymerization, and it will cause the blockage of growth. And it also inhibits the RNA synthesis, means decrease the pyrazinamide is a first line drug. Amide synthesis, bactericidal. Pyrazine, this is a pyrazine 1 2 and CuNH2. What will do pyrazinamide do? Activate the enzyme pyrazinamidase, which is converted into pyrazinoic acid, and inhibits the enzyme fatty acid synthesis. Fatty enzyme inhibits the fatty acid. No fatty acid means mycolic acid synthesis will decrease, and pyrazinic acid cause the liver inflammation, nausea, loss of appetite. It also causes the gut side effect. Now we will talk about again. It is active against slow multiplying intercellular bacilli. Pyrazimide worked in acidic pH. Because it is a prodrug, so we need to convert into pyrazinoic acid to show its function. Para-aminosalicylic acid, second line drug. In this, first we will make salicylic acid, then we will add NH2 amide, paramine, or add paramose. It inhibits the folate synthesis, prevent synthesis, which will inhibit the synthesis of RNA, DNA, and which will inhibit the growth of cell. So here is the mechanism of action. Petridine plus PABA. Like PAS is an analog. Of PABA. In bacteria, PABA binds and help in RNA and DNA. But when we introduce PS is a similar structure. So it will bind to the same site and inhibits the formation of folic acid and DNA and RNA synthesis. In normal cases, PABA will get converted into dihydroteroic acid, then it will convert into dihydrofolic acid, then tetrahydrofolic acid, which will help in the synthesis of RNA DNA. If we have lack of RNA DNA, there will be a disturbance in the reproduction and growth. This is a salicylic acid. We just need to add NH3. So we will do nitration. The nitration, this is a NO2. We need to convert it to amine, so we will reduce it. Reduction with ZNS. Yeah. PB, PAS, para-aminosalicylic acid used in TB and IBS, inflammatory bowel diseases. Now we will talk about the anti-tuberculosis antibiotic drugs. It is a semi-synthetic antibiotic, means half part is taken from the bacteria and half part is produced in lab, and then they both are joined, artificial and natural. It's bind to DNA dependent. It's bind to DNA dependent and RNA purpose inhibits the RNA synthesis. Used with the combination with RIPS. If we are taking streptomycin, we need to take other 4 for its better treatment and management. Rifabutin, cycloserine is a analog of amino acid D-alanine, means it will inhibit the protein production. Cycloserine inhibit 2 enzyme L-alanine and D-alanine. Impair and interrupt peptidoglycan synthesis. If the cell wall peptidoglycan is present in the cell wall, so the cell wall is not formed, so that bacteria will die. Used in combination with other in treatment of TB when primary not work. What streptomycin is a first line drug. First line drug, it's bind to the bacterial 30S ribosomal subunit and misreading of tRNA and protein synthesis will decrease. It used as an antibacterial. It can use in like a sort of broad spectrum and in tuberculosis. Then we have a sapiromycin sulfate isolated from Streptomycin caprolus, and the streptomycin, this is obtained from Streptomyces gracios. It may cause side effect is Myasthenia gravis and neuromuscular disorder. See, for this we have a mnemonic like S and 30S ribosomes. And why Myasthenia gravis occur? Because of aminoglycoside. Streptomycin is an aminoglycoside. Pyromycin sulfate, and it's now. And